The University of Colorado Hospital is one of the Rocky Mountain region's leading academic medical centers. The hospital has been rated in the top 4% in the U.S. for nursing excellence, clinical care, and innovation.
Oh, fine, thank you.
As a top U.S. News World Report hospital and a magnet hospital, we set the standards that people operate by.
NEC has been working with the hospital for more than a decade to help it maintain its elite healthcare status. Recently, NEC helped UCH improve patient care and nursing efficiency through their use of an integrated unified clinical communications solution.
What I find most compelling about NEC's unified clinical communications suite is that in a realistic, real-world environment, if you look at a typical shift of a nurse, that nurse is completely inundated with tasks and data requests. For example, she may be wondering if a particular physician is on site to do rounds with his or her patients that they're attending. Or she may need real-time communication at the bedside with the patient. When she's out on the floor, she still needs to remain in contact with the patient so that they can prioritize the patient needs.
UCH's initial use of unified clinical communications was focused on wireless communications and the integration of the wireless communications with their patient nurse call systems. This project did uncover some unique challenges. The existing wireless handsets the nurses used were inefficient, had limited features, and were cumbersome to use. So the hospital launched a pilot program where the nurses tested handsets from a variety of manufacturers. They chose a solution that met all of their current needs and also supports their unique capabilities for when UCH expands their use of unified clinical communications.
I really like the phones for emergencies. I think that it really affects patient care. You can get a lot more people there a lot faster. You can hit an emergency light and it goes to everybody's phone saying that there's an emergency in that room so that you get as many personnel present as you need.
The nurse gets to do what they do best, which is spend time with the patient rather than time walking to and from a patient room. And we deliver a better quality of care.
So, with the wireless handsets selected, the NEC and UCH teams tackled another challenge. The nurse call system did not interoperate with the hospital's existing NEC IP communications system.
The main challenge that existed is the two systems weren't necessarily talking to each other, and so they weren't getting the most benefit from either. The nurses couldn't interact with the nurse call system from their wireless handset. In other words, they had to still go to the patient room to find out what the patient need was.
Leveraging decades of healthcare experience, NEC seamlessly integrated the hospital's existing NEC solution, nurse call system, and wireless communications.
We allowed them to leverage existing technology, and we even, with our engineering staff, worked with them to create some custom capabilities to allow them to leverage existing technology so that they wouldn't have to displace it.
The result was a phased-in, flexible migration that provides for both current needs as well as future considerations around real-time location services and deeper levels of clinical applications integration.
There's just so much electronic data out there now that's involved in healthcare. The opportunities are almost endless.
Perhaps most importantly, UCH has seen improved nurse productivity and better overall patient experiences.
Our nurses feel like they're spending more time with patients. Our patients feel like they are being cared for better. It's a win for everybody.